Hello, I'm Ben, and you're watching The PhD Parent. In this video, I'm going to provide an overview of separation anxiety in kids, focusing on two issues. So first, I'll focus on the idea that separation anxiety is a normal part of development, and I'll touch on the evidence that supports this claim. And then second, I'll discuss kids who experience problematic levels of separation anxiety and who may end up being diagnosed with separation anxiety disorder. I won't get into interventions for problematic separation anxiety, as that's covered in another video, and you can check out the link to that video down below. So first of all, separation anxiety as a normal part of development. Now to begin, what is separation anxiety? So in a nutshell, it's anxiety in anticipation of or when experiencing separation from an important attachment figure, for example, mum or dad. Now you can read plenty of stuff telling you that separation anxiety is a normal part of development. What you don't typically see is any evidence supporting this claim. So in the following, I'll tell you about a classic psychology experiment from the 1970s, which provides a basis for the idea that separation anxiety is normal in early development. I'll then go on to some more recent work that goes outside the lab and looks at parental reports of separation anxiety in kids more broadly across the population. Now, before doing so, what I mean by normal, and what I assume others mean in this context, is simply what is statistically typical. That is, most kids exhibit separation anxiety, therefore it's normal. So the classic study I'll describe was by Ainsworth, and it was called Patterns of Attachment, a Psychological Study of the Strange Situation. It was carried out in 1978. Now, while the study was not directly about separation anxiety, it was actually to do with attachment styles, that is the relationship between parent and child. The findings are nevertheless relevant to separation anxiety in early development. Now, if you wanted to look at separation anxiety in the lab, what you could do is get a parent and kid into a room and then have the parent leave, that is, separate the parent and kid. And you could then record the degree to which the kid experiences anxiety. And that's pretty much what happened in the Ainsworth study. So in this study, the researchers recruited about 100 mums and their infants who were on average around 12 months old. The infants were exposed to the so-called strange situation procedure. So in this procedure, there are 8 episodes which are intended to become increasingly more stressful for the infant. For the purposes of this video, the relevant episodes are the 4th and 6th, as these are when the infant is separated from mum. So in the 4th episode, which is the first separation, the infant has just been in a room with their mum and a stranger for a few minutes. At the end of this period, mum sneaks out of the room, leaving the baby with the stranger for 3 minutes, or less if the baby becomes really distressed. In the 6th episode, which is the second separation, mum's come back into the room, had a play with the infant, but then left again, this time saying goodbye when she leaves. The infant is then left by themselves in the room for 3 minutes, again less if the baby becomes really distressed. Now, obviously, you can't ask a 1-year-old if they feel anxious. So in this study, anxiety was inferred through observable behaviors. And the behaviors I'll focus on are crying, exploration of the room, for example, moving around the room to get a toy or some other object, and searching for mum. Searching behaviors could either be strong, for example, following mum to the door or going to the door after she's left, or they could be weak, for example, looking at the door, looking at the chair where mum had been sitting, or looking at her belongings. Now here's what the researchers found, starting with the results of episode 4, anxiety during the first separation. So in this first separation, the findings with respect to each of the 3 types of behaviors were as follows. About 20% of babies cried immediately after mum left, with about 50% of babies crying at one point during the episode. About 20% of babies were so upset that the episode had to be cut short. Exploration of the room reduced during the episode, with about 80% of babies moving around less than they did in previous episodes. And finally, while there was little evidence of strong search behaviors, weak search behaviors were common, with about 65% of babies looking at the door and about 45% looking at the chair where mum had been sitting or her belongings. So most babies, in one way or another, showed evidence of separation anxiety during the first episode. But as mentioned, there was a stranger in the room, and this person engaged with the baby, for example, offering a toy, and tried to stop them crying. Thus, this behavior of the stranger may have lessened the anxiety response of babies. Now this brings us to episode 6, anxiety during the second separation, when the baby was left in the room alone. In this second episode, the findings with respect to each of the 3 types of behaviors were as follows. So almost 50% of babies cried immediately when mum left the room, with about 80% of babies crying at one point during the episode. About 50% either cried for almost the whole episode, or their crying was so intense that the episode was stopped early. Again, exploration of the room reduced during the episode, with about 80% of babies moving around less than they did in earlier episodes. In contrast to episode 4, there was now clear evidence of strong research behaviours. About 60% of babies approached the door, with about 25% making some effort to open it. Weak search behaviours were also common. For example, about 80% of babies looked at the door. Thus, most kids evidenced separation anxiety in this episode, with this anxiety appearing to be more intense than in the first separation episode. So taken together, the results of this study provide evidence for the idea that separation anxiety is a normal part of early development, in that most infants displayed behavioural signs of anxiety when separated from their mum. Converging support for these results can be found in research that's used variants of the strain situation procedure. And in terms of the trajectory of separation anxiety across development, 2-year-olds show similar patterns of separation anxiety to the 1-year-olds in the Ainsworth study. Though in studies with older kids, that is 3 to 4-year-olds, while some kids show evidence of separation anxiety, the intensity and prevalence fall off, suggesting that normal separation anxiety may peak around 2 years old, give or take. Now, a general problem with the previous research is that the sample sizes are on the small side and not representative. For example, the babies in Ainsworth were from white middle-class families in Baltimore. So you wouldn't want to make too strong of a claim about what's normal based on these studies alone. A different way to come at the issue is through questionnaire-based studies. For example, the infant-toddler social and emotional assessment is a parent report measure, which, as you can probably guess, assesses social and emotional functioning in infants and toddlers. Of relevance, this questionnaire has a bunch of items that assess separation anxiety. For example, being clingy, shy around new people, getting upset when left with a stranger, and so on. Scores for each domain can either be 0, rarely a problem, 1, sometimes a problem, or 2, often a problem. So using this approach, in a study of about 200 kids ranging in age from 12 to 36 months, Briggs-Gowan found that the average separation anxiety score was about 1, meaning that separation anxiety was generally reported as being a problem for kids at least some of the time. Near identical results were reported by Carter in a larger sample of about 1,200 kids. Again, the average separation anxiety score was about 1, and separation anxiety was the area where kids were reported as having the most problems. Subsequent replications in France, Korea, and Japan have produced similar findings. Thus, the results of these questionnaire studies demonstrate that, in general, young kids have problems with separation anxiety, at least some of the time, consistent with the idea that separation anxiety is a normal part of development. So that's normal separation anxiety, but in the following I'll consider problematic levels of separation anxiety, including separation anxiety disorder. So some kids experience quite a lot of separation anxiety, and it's possible that they may end up being diagnosed with separation anxiety disorder. This disorder is one of the most common anxiety disorders in kids. Around 5% of kids will meet diagnostic criteria for separation anxiety disorder, with the average age of onset being about 6 years of age. So according to the Diagnostic and Statistical Manual of Mental Disorders, otherwise known as the DSM, separation anxiety disorder is when a kid experiences excessive fear or anxiety about being separated from a person or people who they have a strong attachment to, for example, a parent, and this fear or anxiety is developmentally inappropriate. And it must be shown in at least 3 of the following ways. Becoming really upset when thinking about or when actually separated from a close attachment figure, worrying lots about a close attachment figure dying or being harmed, worrying lots about being separated from a close attachment figure, being reluctant or refusing to go out due to fear of separation, being fearful if unable to access a close attachment figure, being reluctant or refusing to go to sleep without being near a close attachment figure, having nightmares about separation, or frequently complaining about physical symptoms when thinking about separating or when actually separated from a close attachment figure. Now, if you reckon a few of these descriptions would fit your child, then it's possible that they might have separation anxiety disorder. However, as a parent and even a clinician, it can be tough to diagnose separation anxiety disorder for at least 2 reasons, each of which is related to how the disorder is classified. First is the requirement that the separation anxiety must be developmentally inappropriate. As discussed, separation anxiety is a normal developmental phenomenon, and so it can be difficult to tease apart pathological versus normative separation anxiety, particularly across the early years of life, for example, 0 to 3 years. And second is the requirement of excessive fear or anxiety. Now, you're not going to find any objective measure that tells you whether a kid's fear or anxiety is excessive. It's a subjective judgment. Now, if you're a parent, particularly a first-time parent, it may be hard to know whether the response your kid displays upon separation is excessive or whether it's normal. Now, you may have some idea, and sometimes it's blindingly obvious, but it may not be clear. So ultimately, getting the input of a mental health professional is likely the best approach if you have concerns about whether your kid has problematic levels of separation anxiety. Now, if you want to know more about psychological interventions for separation anxiety, then you can have a look at my video where I provide an outline of CBT, the most common treatment approach for separation anxiety disorder, and another video in which I provide an overview of the evidence which shows the efficacy of this approach. The links to those two videos are down below. But for the moment, that's it for separation anxiety in kids. If there's anything I've gotten wrong, any important research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.